Hello, my name is Dr. Stephen Cudney.
And I'm Dr. Peter Ingoldsby.
In this video, we are going to discuss the risk and benefits of wisdom tooth or third molar surgery.
This video will provide general information, but we will cover your specific diagnosis and treatment options during your consultation.
Third molars or wisdom teeth develop or grow in the very back part of the upper and lower jaws. A high percentage of wisdom teeth remain impacted, meaning they cannot reach their expected function and remain deep in the bone or partially erupted. Impacted wisdom teeth can become infected, damage or crowd adjacent teeth, or form cysts that can destroy portions of the jaw. For some patients, wisdom teeth can be left in place with little risk of future trouble. For other patients, impacted wisdom teeth will need to be removed to prevent damage to the neighboring teeth and bone. During your consultation, we will weigh the risks and rewards of wisdom tooth surgery and come up with a treatment plan specific for your needs.
While wisdom tooth surgery has a low incidence of complications, it's important you understand your risks prior to surgery. With wisdom tooth surgery, you may experience pain, swelling, bleeding, temporary bruising, soreness or cracking at the corners of the mouth, tissue scarring, damage to your lips, jaw, and teeth, including existing dental work, stress or damage to your jaw joint, or in extremely rare cases, a jaw fracture. Infection can happen with any surgery and is often treated with antibiotics. However, some infections will require prolonged treatment, additional surgeries, or even hospitalization.
There are several nerves in your face, including those in your upper and lower jaws. Dental extractions or the use of local anesthesia can cause injury to these nerves. These nerve injuries can result in altered or loss of sensation, most commonly to the lower chin and lip areas. In rare instances, a loss of sensation to the tongue as well as taste can occur. Nerve changes after surgery usually resolve over time, but in some cases, changes may be permanent. During your consultation, we will discuss your specific risk regarding nerve injury, as your anatomy and age both play a critical role. For those over the age of 25, a three-dimensional X-ray is often indicated to carefully track these nerves to reduce risks during surgery. In some cases, we may recommend partial removal rather than full removal of the wisdom teeth if they are at high risk of nerve injury.
Additional risks associated with third molar extraction include sharp edges or bone splinters where the tooth was removed, an opening from the mouth to the sinus cavities, or tooth roots left in place. Some of these complications may require additional surgery. Some patients may develop a dry socket about 4 days after surgery. A dry socket occurs when the blood clot at the extraction site dissolves early or does not adequately form. Your surgeon can treat a dry socket, but the extraction site will be slower to heal and additional post-operative visits may be required.
As we discussed, your age plays an important role in determining your specific surgical plan. For those in their late teens or early 20s, third molar extraction has less risk and an easier recovery, so often third molars are recommended for prophylactic removal before they develop future problems. If we are relatively confident your wisdom teeth will pose a problem in the future, it is often better to remove them at a younger age when the surgery is more simple and less risky. For those older than their mid-20s, wisdom teeth are carefully examined individually and only removed if indicated by your exam.
Most third molar extractions are completed under intravenous moderate to deep sedation. This type of anesthesia may cause disorientation, drowsiness, nausea, vomiting, or allergic reactions. As with any anesthetic, whether performed in an outpatient setting or a hospital, these risks can be serious and in rare cases may even be fatal. Your IV sedation plan is tailored based on your needs, desires, health, and age. Some patients may have lingering anesthetic effects, including memory and coordination issues for an extended period of time, possibly into the day after surgery. Due to these lingering effects, an escort must accompany you to the office, remain in the office during your surgery, drive you home, and stay with you after surgery until the effects of anesthesia are no longer present. An escort must be a responsible adult that can assist you if needed. Please be aware that if your escort is not available on the day of surgery, your surgery may be delayed, rescheduled, or completed with local anesthesia only.
Thank you for your time.
We look forward to discussing your individual care shortly.